Hello, I'm Dr Zara Quail and I'm the research lead at CareVision's Healthy Aging. In the second part of this interview, we will hear from Reinhard Guss about psychosocial interventions for people living with dementia and their carers. Moving on to focus on the mental well-being of people living with dementia. You were the lead author on a book called The Guide to Psychosocial Interventions in the Early Stages of Dementia, and you've also co-authored a number of other publications on support and interventions for people living with dementia. What are the particular interventions that are available to people living with dementia and their carers?
Receiving a diagnosis of dementia and living with it is often very stressful, both for people with the dementia and for their families. But it doesn't really need to be that way, because nowadays we know so much more than we did 10 or 20 years ago about approaches that help people and help families to have a really good quality of life, often for many, many years after a diagnosis. And in the Guide to Psychosocial Interventions, we have put together what people with dementia asked us to do. In a way, a catalogue of different psychological and psychosocial interventions that can help with a good quality of life. What counts for aging and healthy aging in general, in a way, goes more so for dementia. In order to live well with dementia, we need to keep going with what we want to keep. There is the old saying that if you don't use it, you lose it. And with dementia, that losing occurs ever so much more quickly, and getting things back is ever so much more difficult. So therefore, kind of thinking about what keeps people well, first and foremost, there would be activities again, meaningful activities, things that you're interested in. Is it music? Is it singing? Is it art? Is it dance? Do you like crosswords or sudokus? Do you like pets or gardening? Whatever is your thing, develop it, keep it going, and do as much of it as you possibly can. Exercise is also important, especially in order to maintain strength, to keep coordination, to keep flexibility. So using a gym, going walking, training with weights, whatever is your thing, developing it and doing more of it. Keeping relationships, people, making and maintaining relationships, being part of society, making sure that you're part of a community, keeping friendships going, and looking after family relationships. So thinking about close relationships and wider relationships, and making a very conscious effort to keep them going and develop them further. So those are the kinds of general approaches. And then there are specific psychological therapies that address difficulties with emotional well-being, with anxiety and depression, or with trauma and past issues. And that's important because dementia is a stressful life experience. It adds additional stresses to whatever else is going on in life. If you've always been a somewhat anxious person, you're going to become more anxious. If you've always been a glass half empty and more depressive sort of person, you're probably going to become more depressed under the pressure of it. And it's important to prevent that from happening. There's also an unfortunate tendency, often in later life and with disability, but also with dementia, and that is that past unresolved emotional issues have a tendency to come back and bite people. And it's therefore often important to go back and have a look at issues that have been unresolved, and there psychological therapies are particularly helpful. There is a whole host of different approaches to choose from. Some things suit some people and some things suit others. There is cognitive behaviour therapy that has a very good evidence base for addressing depression and anxiety with and without a diagnosis of dementia. There is compassion-focused therapy that is being investigated increasingly at the moment, that helps especially well with issues to do with confidence and with being overly self-critical, which is something that is particularly difficult to live with in dementia. There is acceptance and commitment therapy, that helps with getting your head round what it is that you are having to put up with and what it is that you can do in order to live well with it. There are mindfulness and meditation-based approaches that help with general well-being, with calming and with grounding. There is counselling and psychotherapy, and there are life review and narrative therapies, all of which help well with issues perhaps buried in the past, with traumatic life events, and with making sure that there is a life story that feels like yours and that feels unbroken and that can integrate the experience of living with dementia. In addition, there are, of course, approaches that are more based on understanding from neuropsychology, from the various tests that people with dementia have to undergo in the process of diagnosis. Those often give very good profiles of what strengths and weaknesses are. And from work in brain injury, rehabilitation, we know what sorts of approaches help with particular cognitive difficulties. So that's the general approach in cognitive rehabilitation, and then there are more specific, well-evidenced approaches like cognitive stimulation therapy, and perhaps for more advanced dementia there are a whole group of reminiscence-based approaches and interventions. And coming back to the importance of relationships with other people and in the family, there are groups and courses that are about living together with dementia that are often offered post-diagnosis. And there are family interventions, systemic family therapy, that address difficulties families might have in communicating with each other about living with dementia and how best to accommodate that with each other. And finally, we know that knowledge is power. Understanding and acquiring new knowledge is often more difficult for people with dementia, but it is not impossible. And there are specific post-diagnostic programs. There is specialist information about the particular form of dementia that people live with, and there are approaches to advanced care planning and thinking ahead about how best to accommodate increasing needs, all of which people with dementia can have very active input to and help to build for a future with a good quality of life. Of course, there are also a number of programs for carers. Carers face their own particular issues when faced with living with a relative with dementia. All the psychological therapies are suitable in their own way of addressing what it is that carers need most in order to support them in their caring role and in their caring task. And finally, maybe it's worth talking about Tom Kitwood, coming back to how much more we now know about positive approaches in working with dementia. Tom Kitwood, 22 years ago now, published his seminal book, Dementia Reconsidered, in which has formed the basis of our changing approach, a change in paradigm of how we look at dementia. And he started developing an understanding of dementia as a biopsychosocial condition where the biological and medical aspect is only one part, but the social, the psychological, the emotional are just as important. And together with my good friend Keith Oliver, who has now lived with young onset dementia for just over 10 years, I've contributed a chapter in a review of the book. The book is called Dementia Reconsidered, Revisited, where along with a number of very eminent colleagues, we have looked at Tom Kitwood's thoughts and written about how these have been implemented and changed dementia care in the last 20 years. One of the aspects of the book that has always been very helpful for me in my clinical practice, but that I also know has been really useful for carers and people with dementia, is Tom Kitwood's Flower, where he puts together the fundamental needs of people with dementia in the shape of a flower with a centre that it holds it all together. And the areas that he identifies are identity, maintaining our personal identity and who we are, and undertaking anything that will help support that. Occupation is his second area. Meaningful occupation, having something to do that is worth your while. The third one is inclusion, and that is about inclusion in relationships, in family, in society, in the community, and how can we ensure that we as a person with dementia or as a carer facilitating a person with dementia can ensure that that happens. The fourth one is attachment, and that is about our central core relationships and keeping those in a good shape. The fifth one is comfort, and that is about ensuring that we have a good, positive, helpful environment to live in that is organised around the needs of the person with dementia. And the final one in the centre is what holds it all together, is love, that all of us need to thrive and feel we have a positive life.
Thank you so much, Reinhard, for those wonderful insights. We're very grateful for your time. If our viewers would like to read any of the papers or texts or see the Keith Oliver interview, the links are in the description section below the video. We look forward to seeing you again for our next Insights video next week. Thanks for joining us.